Hi, Assalamualaikum and hi everyone. We are from Group F4AS12049 and in this video, our group will be presenting about column chromatography in pharmaceutical industry. First of all, let me introduce you to our group members, which is me, I am Najiha, and we have Fadlin Zahira, Nurin Matrisha, and Azrin Nurshafika.
So these are our table of contents. First of all, we have introduction, then methodology, what is chromatography, applications, examples, and lastly, conclusion. Introduction. Chromatography is a fundamental analytical technique which is widely used in the pharmaceutical industry for separating, identifying, and also quantifying various components within a mixture. It plays very important role in numerous stages of drug development, production, and also quality control. As for this presentation, we are focusing on how column chromatography plays in the real pharmaceutical field. So, it does play an important role in the pharmaceutical industry, particularly in the purification of active pharmaceutical ingredients, which is APIs, during the drug development and also formulation. While more advanced techniques like HPLC are used for high throughput analysis, column chromatography still remains valuable in early stage research and also quality control because of its simplicity and cost effectiveness than flexibility. It is especially useful for removing impurities, isolating byproducts, and purifying compounds to meet regulatory purity standards.
We're talking about the methodology of our presentation. This presentation is created based on literature review, column chromatography in pharmaceutical analysis, methods and applications written by Edaf RM. This article describes column chromatography as a reliable and flexible method for analyzing and purifying pharmaceutical substances. It is important for making sure drugs are safe and effective before reaching patients. We also use safer solvents for active pharmaceutical ingredient purification using column chromatography. Article by Yayafa C. Burton D., George N., Morris G., and Wang H.W. to support our explanation. They use TLC and column chromatography to compare how well these alternative solvents separate and purify APIs. Other than that, we also included other reference materials through browsing the internet. So, what is chromatography? Chromatography is a method by which a mixture is separated by distributing its component between two phases. The first phase is mobile phase. This can be liquid, solvent, or gas that continuously flows through the system, carrying the mixture along. The second phase is stationary phase, a solid support material packed with column or spread as a thin layer on a plate. The stationary phase interacts selectively with the mixture's components, influencing their movements. There are many types of chromatography, but in our video, we are focusing on column chromatography. Column chromatography is a technique widely used for the purification of active pharmaceutical ingredients, APIs. How column chromatography works? Firstly, we set up the column. A glass column is filled with a stationary phase, usually a solid absorbent like silica gel or aluminum. Cotton or glass wool plug is placed at the bottom to prevent the absorbent from leaking. Secondly, we load the sample. The mixture to be separated is dissolved in a small amount of solvent and placed on top of the stationary phase. Thirdly, we add the mobile phase. A solvent called the mobile phase or eluent is added on top and flows down through the column by gravity or pressure force. Separation occurs. Components in the mixture interact differently with the stationary phase. More polar compounds stick to the adsorbent and move slower. Meanwhile, less polar compounds move faster with the solvent. Fifth, collect the fractions. As the solvent passes through the column, different components exit at different times. These are collected in separated containers called fractions. 6. Analyze the fractions. Each collected fraction may be analyzed using techniques like TLC or thin layer chromatography, UV light, or spectroscopy to identify and purify the compounds.
Next, I will explain about application in pharmaceutical analysis. First, biochemical analysis. Purification of protein, peptides, and other biomolecules for research and therapeutic purpose. Second, forensic chemistry. Monitoring the stability of drug compound under different conditions. Lastly, environmental monitoring. Analyzing environmental sample to detect pharmaceutical contamination. Next, the example of result in pharmaceutical analysis. First, separation efficiency. The result show that blending heptane with the ethyl acetate, methyl acetate or acetone provided better separation compared to DCM or MeOH. The purity of the recovered API was significantly improved with safer solvent blends. Second, purity and recovery ratio. When the 87.5% DCM in MeOH blend was used for column chromatography, the recovery for ibuprofen, acetaminophen, and caffeine were 90%, 43%, and 35% respectively. However, no 2 ml collision achieved 100% purity for any compound.
For the last part, we have conclusion. So, in summary, column chromatography remains a valuable technique in the pharmaceutical field, especially in the purification and analysis of active pharmaceutical ingredient (APIs) like paracetamol. Despite the rise of advanced methods like high-performance liquid chromatography, or we call it HPLC, its simplicity, flexibility, and effectiveness continue to support drug development, quality control, and environmental monitoring. The use of safer solvent in recent studies also shows promise in improving separation efficiency and API recovery while reducing health and environmental risks. This highlights the continued relevance and adaptability of column chromatography in modern and pharmaceutical practice. At the end of the video, I want to say thank you to everyone who watched and listened to our video. Thank you.